Leptospirosis is one of the important topic in epidemiology of communicable diseases. What is leptospirosis? It is a zoonotic bacterial disease caused by Leptospira interrogans or Leptospira biflexa. This is also known as Weil's disease. Epidemiology, coming for epidemiology, you have to write agent, host, and environment because agent enters the host through environment. Agent factor is caused by already told Leptospira interrogans or spirochetes as they are spirally shaped. Next, host factors. As I told, this is a zoonotic disease from animals. It can infect even humans. So risk groups, host risk group, farmers, sewage workers, veterinarians. All these are the host factors, people who are at risk, high risk groups, and it can affect all age groups. After agent, host I already told. Then coming for reservoir. Reservoir, rodents like rats, even dogs, cattle, pigs also can act as a reservoir. It's not a vector-borne disease. No man-to-man transmission is known. Mode of transmission: contact with contaminated water or soil. Entry through cut aberrations, any where there is a breach in the intact of the epidermis. Floodwater is a major source in India for transmission. Floodwater. Incubation period from 7 to 12 days. Post-monsoon month is the most important month where it's affected. Clinical features include mild febrile illness or Weil's disease, where you can see fever, chills, headache, muscle pain, that is myalgia, conjunctival suffusion, redness of eyes, that is redness of eyes, jaundice, renal failure in severe forms also you can see. After this, how you will diagnose the leptospirosis. I will say, let me clean off this. You will diagnose the leptospirosis by doing ELISA, where you will find for IgM antibodies, which is the most common method. Diagnosis: ELISA, IgM antibodies you look for. 3 R's, which is helpful for you to remember. Rainfall, most common season where you see leptospirosis. Rice field, stagnant water, and rodents are the reservoir. These are the 3 R's you need to remember regarding leptospirosis. Diagnosis, I told, ELISA, IgM antibodies or microscopic agglutination test, PCR, anything you can do. Next, treatment. Coming for treatment for for leptospirosis, doxycycline. Drug of choice is doxycycline. In severe cases, we'll give penicillin G. In severe cases, supportive care like fluids for dehydration and dialysis if needed. Prevention and control, you can do by environmental control or personal protection or chemoprophylaxis or animal control or health education. These are the modes of prevention of leptospirosis. First, environmental control. Proper drainage, water stagnant should be avoided. Proper water drainage should be there. Water should be drained. Rodents should be controlled. And safe water disposal should be there. Personal protection, wear boots, glove when wandering in water. Avoid swimming in contaminated water. Cover any cuts are there like aberration, aberration and laceration. Chemoprophylaxis, again doxine. Even for treatment, drug of choice is doxycycline. For treatment, doxycycline 200 milligrams. Treatment, doxycycline 200 milligrams once week. So once week. For high risk individuals, animal control, vaccination of all animals, like all dogs. Contact with animals should be avoided. Health education. You have to be aware about the risk of flooded water, or promote protective food care like boots. This is all about leptospirosis. If you find this video helpful, please do like, share, subscribe. Before ending this video, I'll read once what is the notes I have written here. Leptospirosis. It's a zoonotic disease, also known as Weil's disease. It is caused by an agent, Leptospira interrogans or Leptospira biflexa. Epidemiology, agent Leptospira vector is not not vector-borne. This is water, through water contamination you will get. Reservoir is a rodent like rats. No man-to-man transmission. Indirect method and direct contact with the water or moist soil or wet surfaces contaminated by the animal urine you will get, or direct contact with the urine products or unpasteurized milk you will get. Next season, which is most commonly affected, is the rainy season, where you can see leptospirosis, and even after floods, like any disaster like flood, which is the most common disease in water-borne disease, is leptospira. Next, risk factors. Risk factors include like a low socioeconomic status, where less hygiene will be there, rainfalls, floods. These are the risk factors. 3 R's you can remember: rodents, rainfall, and rice field. Where in rice field you can see stagnant water. Next, pathogenesis, first phase, septicemic phase, hematogenesis spread, spread through blood. To various organs like liver, brain, lung, and other things. Second phase, immune phase, antigen antibody complex are formed and deposited in various organs. Then renal colonization, it enters the kidney and then colonize. Incubation period, 10 days to 30 days, that is 1 month. Clinical features: mild febrile illness. Then hepatorenal hemorrhage syndrome. Prevention: personal protection, wear protective clothing, cover skin if there is a lesion. Avoid contaminated water. Wash slowly, treat drinking water. Environmental control of rodents, rodenticide, using rodenticide, covering cracks and